When you're doing ED&C, you notice that the curette has two sides to it. There's a side that's angled down, that's the blade side, and there's the back side. So what you do is you hold it like a pencil. You use 3 fingers to splay the skin in 3 directions, and then you start from a little beyond the center, going out past the lip of the lesion, and you scrape. You scrape 1, then you go to the next. Unfortunately, this is a bad human substrate, but you escape 2. You go in this direction, radially around the lesion, and at this point it gets awkward for my hand. I can't go around that way, so what I have to do is change the position of the curette so as to get in all directions. But ultimately, though, I will have gone 1, 2, 3, 4, 5, 6, 7, 8. You know, you get basically all the circumference of the lesion. If the lesion were much bigger, I would go 1 and I would go 2, and this middle spot here gets missed. So then you'd have to start from the kind of midpoint and go through it so that all the surface area of the lesion was gotten. If another strategy, if there's a large lesion, is I can just go like 1, 2, 3, 4, and I can scrape from here this way, from here this way, from here that way. The problem with that is that I don't get this lip. I get this lip, so I get under whatever is there, and I take the cancer out here. But that means I'd have to go in this direction to get this lip, and then I'd have to go in that direction to get this lip, and in this direction to get that lip. So you could do it, but the problem with that is you're going over this centerpiece 4 times, 1, 2, 3, 4, rather than just once in each iteration. So like I kind of much rather doing the spoke wheel radial. Now I have a second lesion here, and I just wanted to note that this first stroke is quite difficult, and sometimes you know, if this is a wart, you may need to burn this a little more, because eventually it should just melt away like butter, but that first one is quite difficult, and eventually it gets off, and you see that like you make this come off, and then it becomes easier to curette. And of course, if this is attached this way, then maybe I go this way and it comes off completely, and that's the same principle as in pairing. And then you do that same situation. Now after this first scraping, you want to get obviously all the dead tissue away. You're left with this second layer. Now if this were real skin, it would be bleeding, and we're going to address how to do that in a second. Now you notice that there is debris in this. I either submit it to pathology or I just fill this with water and I just shake it out in here, and it should come out if you do it enough. And notice how I'm holding this. I'm just letting it dangle, and it goes back and forth rapidly. And I just want to re-emphasize one point. Let's say I didn't splay the skin and I scraped. There's a chance that I don't quite get under the lip of all the lesions. So what I want to do is really put tension and then scrape, and then I'm sure that I've gotten that I'm catching all of the lesion. Now note how I'm holding this. I'm holding this mainly parallel to the plane of the lesion, and I'm not holding it like this. I'm holding it like this, and I'm moving in the direction of the handle. So I'm not going like this. This is ineffective. This is ineffective. This is effective. The handle moves that way, I drag that way. The handle moves that way, I drag this way. Also notice that at the very least, if I'm dragging this way, I'm putting traction that way. But the honest truth is that I'm putting traction in all 3 directions. The most important traction is my thumb when it's going opposite my thumb. And the most important traction is my pinky when it's going opposite my pinky. So how do I know that I've finished with this material? Well, I've basically, with my first pass, it's when this feels kind of smooth, and I'm not getting any, and I'm not getting any more debris inside the curette after scraping, that means that I know that I'm done with my, with my first pass, and certainly when I've gotten the whole lesion. Sometimes you have a little floppy area here, especially if you're curetting a condyloma or something. And also after you curette, there's going to be blood that's pooling here. So you have pooled blood plus this kind of catapult that launches the blood over. In that case, you need like a gauze to be over this while you're curetting. Or you blot, curette, blot, curette, blot, curette. Once there's bleeding, we'll pretend there's blood here. I take aluminum chloride and I roll it like as we've seen in the hemostasis videos. The first pass, you have to do electrodesiccation. So there was pass 1 and electrodesiccation ones, C and D. So I like to go around the lesion in a circle, and then I like to color this in. Now, if you put aluminum chloride, you're gonna be able to see where you colored in better. But that's in the hemostasis video. Just notice one thing: if I dwell very long in any one spot, I'm gonna burn right through the skin. You don't want that. So you can't dwell very long in one spot. You almost have to have like a quick tremor when you're doing it to color it in, and you constantly have to move along. You have to constantly move along, a quick tremor, and move along. And in order to know how far you go outside, to not go outside the bounds, you color it in, and then you can tremor exactly to the, from this end to that end, and that kind of tells you how far to go. So it takes a little practice, but you definitely have to err on the side of moving it along versus staying in one spot and spacing out, because you'll burn right through the tissue. Cycle 2 is the same as cycle 1. You're gonna scrape all the areas, and you can do this reasonably quickly, so long as you just get the lip of the lesion. And normal skin is not going to be this tough. I tend to like to do electrofulguration rather than desiccation certainly for the second and third passes. So fulguration is, you'll see the spark the probe doesn't touch the skin, but the spark jumps. That's fulguration. Desiccation tends to be deeper, so I like fulguration over desiccation for the second and third passes. Okay, the last cycle, you've scraped, you've burned, and now I'm scraping again, and you feel this the tissue comes off really easily if it is diseased burned tissue. But even if it's healthy tissue, it should feel slightly gritty, but nothing should come off. And remember that I always want to go radially. This concept of trying to scrape off circumferentially, that may work to get the last little bits of debris off in this case, but typically you want to make it so that you get the lip of the lesion, the lip, and you want to clear everything of any debris. And now I have a kind of cleared cancer, right? I scraped, I burned, I scraped, I burned, I scraped. That's 3 scrapings. The last burn is only for hemostasis. It's not therapeutic anymore. So you can either do hemostasis with aluminum chloride if you feel the skin is very thin and it's going to pierce through to the fat, or many people just do a final electrofulguration that's gentle, and then you're done. And whether you want to go circumferentially around after or before is up to you once you get. For example, a seborrheic keratosis, and you're not taking the first pass for pathology, then you can burn the top and then scrape. If you think it's a basal cell and you want that first scraping for pathology, certainly you scrape without cauterizing. You put it in the bottle, and then you can do your the electrodesiccation. So when you do a classical C&D times 3, you don't desiccate first. You scrape first, and then you desiccate. I initially desiccated this lesion because I wanted to create a fake lesion. The electrodesiccation burns through all the way to fat. You may have to just do an excision and sew it up because you won't know if if the cancer is in the fat as well or not. So then you'd need like a histologic margin.